Hi, I'm Jennifer Shea, and I'm here for the February monthly update. I have with me Dr. Haley Taormina. Welcome to Regions EMS. Can you tell us a little bit about yourself?
Yes, thank you. I'm so excited to be joining the team. I'm Dr. Haley Taormina. I am the current EMS Fellow and will be joining the Medical Director's team at completion of my fellowship in September. I attended medical school at Mayo here in Minnesota, finished up residency in emergency medicine in Wisconsin, and I have an EMS background as an EMT basic during college.
Oh, how fun. Where did you practice as an EMT?
So I was in my small college town, mostly doing transports of the local college kids. We were quite busy on Friday and Saturday nights.
Love it, love it. So we've had some interesting questions come both through CME and through the EMS education inbox. One is people are really wondering, what is the difference between Haldol and Droperidol?
It's a great question. Droperidol is really making the rounds across the country as a great option to treat patients who are agitated. The best benefit of Droperidol is the faster onset compared to Haldol. Droperidol's onset of action is around 5 to 10 minutes if given IM versus Haldol, which is more like 20 to 30 minutes. And as we know in those situations, time really does make a big difference.
Oh, that sounds like a great improvement.
Mm-hmm.
So with spring coming up, there's always a lot of discussion when we have drownings or near drownings. What are the time points, the differences when we switch from a rescue to more of a recovery mode?
Yeah, very important to think about, like you said, as we're approaching those warmer months. So we know patients have the best outcomes if their submersion is less than 5 minutes. Outcomes start to go down once that submersion lasts longer than 25 minutes and approach zero once a patient is submerged for more than 60 minutes. Generally speaking, once we hit that 60-minute mark, that's when we switch from rescue to recovery. However, there are a few select circumstances, such as pediatric patients or cold water submersions, that can alter that 60-minute time point. In those cases, we would ask you to contact the medical control team for further direction on those cases.
That's helpful, to be able to reflect on that speed that we have to move at. One other announcement we had is Station 51 is collecting used clothing. The students at Station 51 would utilize old boots, used pants, any uniform shirts that are not marked or can have the patches taken off. Those can be either sent to Regions EMS, or if you email us, we'll come and pick them up. It's a good way to use those clothes that aren't quite usable anymore. With that, I want to thank Dr. Taormina for joining us, and hopefully you see her on the street soon.
Thanks. I'm excited to be a part of the team.